And we are back again with a brand new episode of Another 24. I am your incredibly handsome host, Taurus Montez, and today I have a very special guest in the building. Now, this guest is a board-certified head and neck surgeon. Well, from what I just found out, is the best plastic surgeon in 2026. I have the one, the only, Dr. Aaron Fletcher, man. How you doing?
Good, man. Thank you for having me.
Yeah, for sure. Thank you for pulling up. I know it's a hop, skip, and a jump away, but you're here. Now, you are, like I said, one of the best plastic surgeons in 2026.
Yeah, so they say.
So they say.
I'm gonna roll with it.
Yeah, and I know that was probably a long and arduous road, not easy.
Yeah.
But I'm curious about how you were growing up to become this type of person. So what was it like growing up as Dr. Aaron Fletcher before you were Dr. Aaron Fletcher?
Yeah. Well, I grew up in the D.C. Metro, so
Okay.
I got three siblings, two brothers and a sister. I'm the middle child, and we just had a real active household.
Yeah.
Between the four of us, we played a lot of games. We entertained each other. A lot of video games, a lot of sibling rivalry going on. I was into science from a young age. I like to draw.
Okay.
Very artistic.
Gotcha.
And I just played a lot of sports around the neighborhood.
Yeah.
We had a lot of friends in the neighborhood, but we made pretty rowdy bunch ourselves.
Yeah.
So we just had a real active childhood, and I wasn't the most studious kid, but I definitely had a liking for art and science from pretty early on.
And that makes a lot of sense.
Yeah.
For how you turned out.
Yep.
So what is it about sciences you think that gravitated you towards it?
I think from what I can remember, I always liked anatomy. You know what I mean?
Okay.
Like I remember, I think it was like 6th grade, we dissected a frog, and I was like, man, this is crazy.
Right.
Dope. You know what I mean? So I just was always into like seeing what's under, behind the skin and seeing how things are put together. And then when I got in high school, I think I was like really into science a lot more, and we did a dissection on a cat. So I remember all the things I dissected when I was coming through school. So that lets you know I was kind of already had some type of surgical inclination. But I think I just like anatomy, and I like seeing how things are put together, and being a technician of the human body, which I think is really the greatest creation of all time.
Wow.
I mean, in my opinion. And so just being a student of the anatomy and always learning from the variations you see from patient to patient. It just keeps me busy, and it makes me a lifetime learner.
Got it. Now, where did the art come in? You say you like to draw. Was it you drawing cartoon characters, anime, that kind of stuff?
Yeah, I was always making my own comic books, making my own characters. I read a lot of comic books growing up, and I used to. My mom used to get me little sketch pads and pencils, and I would just go to town on those in grade school. Yeah. And so, I think I always had an appreciation for art and just putting my own spin on things, and that translates pretty well into plastic surgery, because that's basically sense. Art with the scalpel, in my opinion. So, I think now that I look back, I can see where it all started, but. As you said, it's been a long journey to get here.
Right. So, okay, you're in high school. You're dissecting frogs, and we did worms. I think we did a frog
worm too. Yeah, I remember the worm days.
Yeah, you're going through high school, and you are, it's time for you to go to college, and you're making that decision to either, to pick your major. And you settled on going the medical route. Is that something you always saw for yourself, you think?
Well, I actually, with my undergrad major was English. So when I first came to undergrad here at Morehouse College in '96, I wanted to make movies. I wanted to be like Spike Lee. Yeah, I was like, I love School Days. To this day, it's like one of my favorite movies. My uncle, Ossie Davis, was the football coach in that movie. So
wow, that's your uncle. Wow.
Yeah, I was always into like just film, and even thought about acting at one point. But I came here to make movies. So my undergrad major was English, because Morehouse doesn't have a communications program, or at least they didn't at that time. So I just planned on studying English and learning how to write screenplays and direct and stuff like that.
Gotcha.
And somewhere in my junior year, I felt like a spiritual experience where I felt like God was calling me into surgery. So I picked up pre-med as a minor. I finished out my English, and I told myself, if things go the right way, I'm gonna keep going with this medicine thing. The rest is history. I just, kept following one thing after another. I got some help, some mentorship from some very instrumental people at Morehouse that helped me get into medical school, and then after that, I was playing with house money, so I just went for it, went as far as I could go.
Got it. So you were interested in movies. Wow.
Yeah.
So you more interested than you give off, man.
For sure.
Wow.
I think so.
Wow. So what were some of your favorite movies growing up? I know you said School Days.
Yeah, I liked all the Spike Lee movies.
Okay.
All the Spike Lee joints. Do the Right Thing, Malcolm X. I liked, Boys in the Hood is a favorite of mine growing up.
Ricky.
Menace to Society.
Yeah.
All those movies were out when I was coming through high school. And all the hip hop movies, Beat Street, Crush Groove, Breakin', you know what I mean? Those are like my favorite hip hop movies. So yeah, I watched pretty much everything. All the action movies that were out at the time, all the superhero movies.
Got it. Okay. So you were pretty much, the medical route was pretty much just thrust upon you. You weren't seeking it out, and
well, I think I could have, went a few different ways, but when I felt like God was speaking to me to be a surgeon, I was like, well, it kind of makes sense. I like the anatomy, I like art, so. But I felt like that was what I was supposed to be doing as opposed to movies, and I felt like I really wanted to be in my purpose and not just be doing something that I selected. So. I figured if it started going well for me, that's what I was supposed to do, and here we are. And it's ironic now because now I'm working on making my first movie, which is going to be a documentary project that I'm putting out later this year, and I'll have more information on that later.
Okay,
I came back around to film after going the medical route, so that's gonna be kind of
we definitely got to talk about that when it comes out.
For sure.
Okay. So I'm one of those people, man. I got my bachelor's and I was like, I'm good. I got a psych degree. I could have went to get my master's and everything, but I was just like, I did enough school.
Yeah.
But medical school, that's like what, another 6 years?
Another 4 years.
4 years?
Yeah.
Okay. And then I'm sure you have to do your specialties.
Yeah. And then after medical school, I did another 8 years.
Wow.
So my surgical training, ENT, facial plastics, and then I did some research in there too. So I went to school forever. It seems like I've been in school almost as long as I've been alive. It seems like.
Yeah, I guess we're always doing some type of school.
For sure.
Right. But what was medical school like? Because I imagine you're waking up at 4 o'clock studying, you're studying all the way to 8 o'clock at night and stuff like that. So what was it like for you?
It was good. It's a lot of, I would say it's not, I won't say it's intellectually difficult, but it's just the volume of material is what I always tell people. So if you can do college, you can do medical school, but you just have to be a lot more structured and disciplined with your time, and you have to make sure that you get all the information in before you're tested on it. So some people would sit and lecture all day and take notes. Other people would get the information that they would give us and stay home and study. So I was a mixture of both. Some lectures I liked to sit in. I loved anatomy. That was my favorite class in medical school. Other stuff like biochemistry, I found myself falling asleep when they would turn the lecture hall lights off. So that stuff I would study at home. But it was a mixture of, it's a great experience. I mean, I look back on it and I don't remember there were times where I felt overwhelmed, but I never felt like I was going to quit, and I felt like I belonged the whole time because, like I said, I felt like it was a calling and not just a choice. So I wasn't going to let myself, flunk out for any reason.
There you go.
Yeah.
Can you still name all the bones in the human body?
No, but I can tell you there's 206, so I can tell you that, but I can't name them all.
Right.
It's been a while. But yeah, my area as far as like, the head and neck, I could run through that real easy.
Gotcha. Okay, yeah, I remember we had to memorize it in high school, and of course, I completely forgot now. So.
Yeah, me too.
All right, so you're going through medical school. It's you can handle it, but it's a lot of work. And you're coming up on graduation. I'm sure you could have went a lot of different ways in the medical field. You could have probably went been a pediatrician or podiatrist or whatever you wanted to do.
Yeah.
So what made you land on facial surgery or surgery in general, plastic surgery?
Yeah. So So I knew I was going to be a surgeon from the time I got there. I was like, I knew because like I said, that's what I heard God say. So
gotcha. Dang,
I was like, well, let me get into anatomy and see what I like. I thought initially I was going to do cardiothoracic and do heart surgery. I flirted with orthopedics. I flirted with neurosurgery. I thought about OB-GYN for a while. I like the head and neck anatomy the most. It's like the most complicated. There's a lot of nerves and blood vessels and bones and cartilage, and you got to work around important structures like the eye and the brain. And I found a mentor when I was going through maybe like my second or third year of medical school. His name was Dwayne Sewell. He was an ear, nose, and throat doctor, a brother, that I met at UPenn. And he became my mentor, and he was just like, look, you could do it. He was the person who demystified the specialty for me, told me what was cool about it, and kind of just gave me an inside look at it. And once I met him, I was like, yeah, this is for me. Because I kind of wanted a mixture between something that had a lot of intricacy, but it wasn't going to, like, destroy my personal life. Like neurosurgeons, they work super hard. They're always waking up in the middle of the night. I mean, not all of them, but the ones who deal with trauma, the brain, and stuff like that.
There's not many people that do it. So
and you want predictable hours once you've been training forever. You kind of want to have something that fits the kind of lifestyle that you want. Medicine can be all consuming, and you want something where you can still sneak out a personal life and some, just fulfill some other goals in life. So yeah, that's how I chose ENT. It's a good mixture of intricacy, but it's not like a lot of emergencies.
Now I imagine, because being a plastic surgeon, especially in the facial area, every patient is different. You're never running into the same thing twice.
Yeah.
So when you're going through, surgical school, I guess it's whatever it's called, I don't know. How do you practice for something like that? I'm sure they got the medical dummies, but for a face that's different every time you have a patient, how do you practice for something like that?
Yeah, so that's a great question. I mean, it's just like anything else. Like if you're a technician of anything, if you fix cars or you fix computers, you kind of have some core skills that you bring in, and how, in general, how to approach a nose or how to approach, a facelift or how to approach eyes. And you just kind of, when you're in residency, which is where we train, or fellowship, which is where we specialize, you get a lot of experience under your attending physicians. So that's kind of like your apprenticeship. You're watching how they do things. You're watching how they approach different anatomy, different patients, and taking a lot of notes, reading a ton of articles. Like I would say I probably read 4 or 5 articles every week.
Still.
Just on my craft. Yeah, like every year or two they update techniques. There's new articles that are written. So I'm constantly reading. I'm going to courses where they teach on cadavers how to do certain techniques. So that's where we really learn, as we do cadaver study. But
makes sense.
Once you get to the real patient, you better have it together. So yeah, I mean, it's always learning. It's just like a barber, like you might have done a million fades, and then you get one where you're like, man, like I got to improvise. So there's a part where you got core knowledge, and then there's some improvisation involved, and that's kind of like what makes you, an excellent surgeon. Is you're always blending those two things, and you're always picking up new skills and new ways of doing things.
Got it. So when you're doing a surgery, these are just questions I have because I'm just like fascinated by this. So when you're doing a surgery, right, is it a step-by-step process? You do the same thing every time? Or like if you're doing like a rhinoplasty, is it the same exact way that you approach it every time? Or is it, do you come up with different strategies or different methods for each?
I think the core things, like how you open the nose, where you put your incisions, if you're going to take a hump down on somebody's nose, it's pretty much the same techniques.
Got it.
But I actually sit with the patient in the consultation ahead of time, and I try to get their top 3. Like, okay, do you want your nose to be smaller on the tip? Do you want a hump removed? I write those things down, and that's my game plan going in. So when I go in, I still know, okay, I'm going to open the nose like this. I'm going to, use this to stop the bleeding. I'm going to, augment it or fix it this way. But I try to get each patient's particular roadmap for a successful surgery, because everybody's different. Some people have no problems with the way their nostrils are shaped, but they may want their tip smaller. Or they may say, I love my tip and my nostrils, but you got to get rid of this hump, doctor, or whatever. So that's becomes my game plan. You know, I'm never like freestyling it. You know, somebody sits in my, you know, chair. We're developing a plan based on what they want to see. So
exactly.
It behooves me to have, you know, the ability to work on a lot of different things because then I can offer, you know, kind of like, you know, a waiter coming with the menu and say like, hey, this is what I recommend. You know what I mean? This is what I think it should look like.
Right, yeah.
And that way they can decide and that, you know, I can go in there with a plan. But I always go in there with a plan.
Yeah, for sure.
Everything has the same steps generally, but I may not be doing all of those steps on the same patient because they may want something completely different. You know?
Got it. So do you remember, are you graduated from, I'm just gonna call it surgical school because I don't know what to call it.
Residency,
okay.
Yeah.
So you finish residency, you're ready to get out, start your career on your own. But, you know, that's also, you have the technical side, you have the skills as a surgeon, but there's also a business aspect to it.
Yeah.
So how did you marry those two parts of the process? Because those are two completely different things.
Yeah. Well, I'm the type of person, I'm an entrepreneurial guy. You know, like I just feel like I gotta own my masters. You know, I went to school for too long, and I just wanted to own, you know, what I produced and have control of it. So nothing in medical school prepares you for entrepreneurship. Right. I would say maybe just endurance, because I think the most important skill you have as an entrepreneur is you have to be resilient and you have to be scrappy.
Yes.
You have to be able to get up when you're knocked down. You got to have determination. So I got some of that in medical school, but in terms of like how to manage a business and, you know, securing commercial capital and, you know, running payroll and, you know, making sure ends are met every, you know, profiting, like that's stuff that you just learn as you get out there. So I married it just by jumping off the porch, really. Like,
you had no choice.
And I read some books, you know, there's a few books on medical entrepreneurship, but, you know, your business model is only as good as what you provide the customer. In my case, it's surgery, so I had to get really good at surgery to survive. You know, I had to build a reputation where people are going to let me, you know, operate on it. That's not like, you know, small. And plus, people, you know, they always look at me and say, man, like, you don't look old enough to be doing this. And I'm like, look, man, trust me, I'm old enough. I can show you my degrees. I got them on the wall. Like, so just building that trust of like, okay, this guy is good and we should send everybody who needs this particular thing to him. That was just, you know, those things go together because the lifeline of your business in medicine is your reputation and what people say about your work. So, but in terms of just straight entrepreneurship, I've been running my practice for 10 years now. Wow. And every year there's something I learn brand new about entrepreneurship. Medicine maybe not so much, but definitely running a business, I learn something new every day.
Which one do you think is more difficult?
That's a great question. I think they're difficult to do together for sure. I would say entrepreneurship's harder. Yeah. Wow. Way more unpredictable.
Y'all heard that entrepreneurship is harder than being a plastic surgeon.
People make it look easy. I mean, I study entrepreneurs. Like I study hip hop entrepreneurs, business entrepreneurs. I try to pick up little gems, but you just got to be in them shoes and you got to walk it out and see what it's like, because there's no blueprint. You know, nobody can hand you a blueprint for entrepreneurship.
Yes, exactly.
Except, like I said, the fact that you're going to have to endure, you're going to have to be resilient, and you're going to have to be scrappy. That's what I would say. Right. But those are things you learn by just having experiences in it. You know? Yeah. That's what I said too, man. I was like, nothing could have prepared me for, because I was laid off from my job. Yeah. So I was like, I got to get out there. I got to figure it out. And if somebody would have told me, like, you know what, you're going to have to go through all of these things. You're gonna contemplate life. You're gonna have, you're gonna rethink your whole entire existence. Yeah, I would have been like, okay, cool. But when it actually happens, you're like, nah, this is not cool. Yep. This is hard. This is tough. Yep. But wow, entrepreneurship is harder than plastic surgery. 100% agree. Yep.
Right. Wow. Okay. So you've been running your practice for, like you said, 10 years now. So you're seasoned in the game. You've solidified your reputation. You got some great clients under your belt. What do you see for your practice in the next 10 years? Do you want to expand to different locations? Or?
Yeah, I'm looking to expand. I mean, I'm on the south side. I'm in Stockbridge right now. You know, that's like south of the airport, about 30 minutes, well south of the city. I get a lot of patients that travel really from all over. I get patients from the West Coast. I get patients from the South. I get patients from up north, D.C. That fly in. I get patients from out of the country that fly in.
Wow.
So, I think where I'm positioned is great, but I definitely want to get more centrally located in Atlanta. So I'm looking at doing that in the next probably 12 to 18 months, maybe adding a second location. And just kind of scaling everything else that I offer. I have products in my practice. I have my own sinus rinse that I created, this character named Dr. Knows Better, which is like a kind of a tongue-in-cheek edutainment flair. And we have...
yeah, I know. I saw that on your page.
Yeah. So my brother and I, who's a nurse actually, he went to Clark Atlanta when I was at Morehouse. We're super hip-hop heads. You know what I mean? Like, we love hip-hop music, like going back to the origin. And so we wanted to use hip-hop to educate people about the ear, nose, and throat. And so... I just want to scale my products. I got a scar gel that I launched maybe a couple years ago for people who are healing from surgery and they want to make their scars fade away. Silicone-based scar gel. So we're try to get that on e-commerce real soon.
Wow.
And just trying to scale my location maybe once. And I'm maybe looking at some satellite options maybe in other states, if that works out. So
that's going to be another leg in the entrepreneurial journey.
Not that I need it, but I just, I got to expand, after 10 years. So.
Okay. All right. So switching gears a little bit, focusing on, the actual profession, your day-to-day operations, the clients that you're speaking to, beauty standards it's kind of like hip hop almost, at least in my observation. It's like every 10 years it switches, or every 5 years things change up, right?
For sure.
So what do you think beauty standards are doing to the average, person or average woman that comes to see you think?
I don't know if it's the standards, but I definitely think social media has been... I think we're going to look back 50 years from now and say, like, social media was a big inflection point in the way people perceive not only themselves, but the way that they are perceived by the world. And that puts additional pressure on people to look their best. Right. So a lot of people are coming in to achieve a certain effect on camera or on their social media. Like, hey, I want to get, when I turn my head to the side, this double chin is bothering me. Or people during the pandemic were targeting plastic surgery of the face because they didn't like how they looked on Zoom,
Wow.
So social media technology, people are just more conscious of, there's more opportunity to share your pictures, but there's also more opportunity to draw that scrutiny. So I think people's standards are changing because there's just more opportunity to share yourself.
Right.
And also, you have these influencers that are really driving these procedures. Like I think, Kim Kardashian really drove the BBL market, I think, you see with Kris Jenner, for instance, she's driving the facelift market right now because of her facelift a few months back. So I think just, people are more comfortable and it's become less stigmatized to have work.
Right.
And then now people are more, everybody's a celebrity in their own social media world, right?
Right.
So you got your followers, you got people who are commenting on it. So it's driving, it's the increased attention is really driving the industry, and people are less likely to feel like it's taboo to go get work done because everybody's doing it now. Because everybody has to. And I see an explosion in men because for the same reason, a lot of men, whereas it used to be seen as like, man, to get your whatever done, that's a girl's thing, that's a woman's thing, but now it's like, man, men are like just as competitive in the marketplace. They're on TV, they want to look their best, so they're courting attention.
Wow.
So I don't know where it's going to go from here, but I think social media really like created a huge uptick, a big boom,
Yeah, I guess like you said, there are more opportunities to be seen, to be scrutinized, and you want to look your best every day if you're on camera all the time, and especially if you feel like you're a celebrity. And then I think social media was one, and then filters allowed people to change their face without surgery and try on a look, try on a nose, try on a set of eyes. Right.
And so, I had people coming in saying, look, I want to look like my filter,
Wow.
And that's crazy. So, or I want to look like this person, what I mean? Or I want this person's nose, because they've seen it in a filter. So those two things, I think social media and filters have like changed the game.
Wow.
Especially for face.
Yeah, got it. So do you think that natural beauty will become like a myth in the next 5-10 years? Like,
no, I think it'll cycle back. You know, like
okay.
right now we're in what's called the undetectable era. So, you know, people are trying to get surgeries that you can't really identify. So instead of it, you know, like BBLs are going through a renaissance where, you know, it's not this kind of like full diaper look. Right. That's what I call it. And people are getting like skinny BBLs, or they're getting less, you know, more scaled down versions of breast implants, or people are getting the implants or the BBLs reversed, you know, or their fillers dissolved, because we're getting back into looking more natural. Right. And so maybe in another 20 years, it might go back to the exaggerated lips or the big, you know, big booties, or the, you know, who knows. But it cycles, and it cycles based on the popularity of a particular celebrity or their particular features. Like I said, I think Kim Kardashian, I would say she probably made more BBL millionaires, right, surgeons than anybody, you know, or just the things that she'll promote on her show, the vampire facial, or this, you know, they got this salmon sperm facial or whatever. She's promoting that stuff to her audience, and then they come in asking for it. So I think if we get another celebrity that's comfortable sharing what they had done, that's going to drive another uptick, especially if they're really popular.
Right. Do you think a lot of those beauty trends, do they work, you think? Like the salmon sperm and all this stuff?
I don't know, man. I mean, I think, you know, the ultimate real, you know, cheat code is just to take good care of your body. You know, eat a good diet, get plenty of sleep, drink lots of water. Like, that's the ultimate cheat code. But, you know, there's stuff out there that works. Most of the stuff doesn't work, I'll be honest with you. There's a lot of stuff being promoted that does absolutely nothing. But people are in search of, especially they don't want to have surgery. So if there's something less invasive, or it doesn't involve as much downtime, then people are going to try it. So I don't know, but I had to see some before and after.
Got it. So you mentioned you're seeing more men in this space. What are the procedures that men are coming to you for? Is it the nose jobs? Is it fillers, Botox? Like,
yeah, men want their eyes done. So blepharoplasty, you know, that's, you know, basically people who come in with puffy eyes or hanging skin above the eyelash line. Because people want to look more refreshed. Hair transplants are really hot in men, especially now people are going overseas to Turkey. Yeah. You got men doing lipo now. Oh, you got some popular people doing lipo. I mean, we heard some rumors about people, but lipo is, and especially men who have what we call gynecomastia, where they have like, you know, that's the medical term for man boobs, where they have extra fat or fatty tissue. Men are getting that done. Facial implants, like if they want to look like more like masculine, sharper features. I have people doing chin implants and buccal fat removal, removing cheek fat if you got like big round baby fat type cheeks. I've done a few of those, and if you do it on the right person, it can really, like, I mean, catapult somebody. I had a few people that have gotten, you know, after that surgery have really gotten deep into acting and modeling and stuff like that. So yeah, I think men, you know, men are doing not as many facelifts. Nose jobs are always going to be popular with men. But yeah, eye lifts, nose jobs, implants, and lipo, I think, are the big, and hair transplants.
Okay, all right. Yeah, I can see the hair transplant thing. Yeah. Because, you know, now that, you know, baldness sounds like it's almost a choice nowadays.
It is, yeah. And they've gotten better and better at it, and, and the prices are going down. So, you know, you can get a reasonable, you know, nice hairline for, you know, less than $5,000 if you go to Turkey. You know,
I don't need one yet. I think I think I'm good. I got a few more years.
Yeah, me too. I hope I hold on, man.
Yeah, yours look
pretty
strong.
I don't think I could do it. Yeah.
So, you know, I think that, you know, with a profession like yours, you know, you speak to a lot of people, they are revealing their deepest insecurities about themselves. So how hard is it from your position not to have a judgmental view or judgmental approach to what some of your patients are asking for?
Yeah, I think, you know, that's part of the art of this. You know what I mean? Like, I think any surgeon would tell you, like, it's the patients that you turn down that makes your career, not the patients that you accept. Right. Because one bad patient will really, you know, it can torpedo your entire practice. So
for sure.
I think patient selection is a lot of psychology, to be honest with you. You got to learn how to read people. You got to be able to speak to people's insecurities. You have to be empathetic, and you have to be able to tell somebody, you're beautiful as you are. You know what I mean? Like, if you're greedy, you're going to try to put everybody on your operating room table. Yeah. But once you get into the game and you start seeing the nuances in the consultation process, you start seeing there is a large amount of psychological screening that's happening while the patient is telling me what they want done. So you become sharper at that the more you talk to people in general. Because I meet people out and they'll be like, man, what do you think about this mole? So I'm constantly being trained in, okay, how do I tell this person I don't think they need surgery, and how do I tell this person that they do need surgery without hurting their feelings? You know what I mean? So that's the art of the consultation. You know what I mean? Straight up.
God, wow. Yeah, how hard is it to have that conversation? You're like, you know what, you do need surgery. I'm sorry.
Well, usually I try to let them tell me, and then I say, yeah, I can see that. You know, I can see you doing that. That would look good. You know, but most people, by the time they come to the office, they've already made up their mind if they're going to do it or not, and they've probably done a lot of research. They've done research on the procedure. They've done research on the doctor. They probably watched some influencers on TikTok or Instagram talk about it. They maybe watched some YouTube videos of somebody vlogging about their experience. So now people are really coming in just to seal the deal. So by the time they come in, we've already agreed on, you know, okay, this is what you're coming for. So it's just a matter of like, do I see something that I can actually fix or not? And if I don't, then I say, you know, you might want to find, you know, get a second opinion or find another surgeon.
Got it. Yeah. Now, you, like you said, you know, you specialize in the face, right? Now, the face, that's the face. That's the billboard. Like, that work cannot be hidden. Like, no matter, you could probably hide a tummy tuck.
Yes.
Or you might even be able to hide a BBL, you know?
Yeah.
But what is that pressure like, knowing that your work can never be hidden?
It's huge, man. Yeah. I mean, I'll tell you, like, there's plastic surgeons that are amazing plastic surgeons. They won't touch the face. They won't touch the nose. They won't, you know, they won't do a facelift because of that. You know, there's no hiding once you do it. I remember the first set of surgeries I did, I couldn't sleep the night after, because until I saw them back and I saw, okay, they're presentable.
Right.
You know what I mean? But you don't want to botch nobody's face, man. Like, that'll follow you your entire career. Like Michael Jackson, I watched him. Growing up, I watched him change. You know what I'm saying? And I just remember being like, how could his surgeon be out still promoting what they do? You know what I mean? Like with this out here. So I think about that every time I take a patient as a client, and I think about every time I'm doing the surgery. I actually sit there the night before and I stare at the pictures, and I try to do the surgery in my head at least once or twice, how I want it to go. I try to picture the outcome. So that way I leave very little chance that I'm gonna, you know, screw something up. We all have surgeries we would want back, every last surgeon.
Right.
Nobody's batting 1,000. But yeah, this is very high stakes work, and that's why I think you really have to select your surgeon carefully. You got to look at what they've done in the past. You got to look at their reviews. You got to look at, you know, their professional standing, and you might want to get a couple different opinions, because once you cut on your face,
wow,
you can't fit. There's a lot that you can't fix.
Yeah, dang.
Yeah.
I bet you feel like Michael Jordan before the finals. Like,
oh man,
it's my time.
I mean, now I'm like, when I see people back and I'm very happy with it, I'm just like a little bit of a sigh of relief, but I'm also kind of like, you know what I'm saying?
Like, I did that.
You know what I mean? So, and it just builds my confidence for the next one. You know what I'm saying? So, you know, now that I've been in it 10 years, I'm less afraid that I'm gonna botch something. But you know, everybody's got a bad day. You know?
Yeah, facts. Okay. So, have you done like a full reconstruction on the face before?
When I was in training, we used to get like some really crazy trauma. You know, people, gunshot wounds. You know, ATV rollovers, snowmobile accidents where people just like crush their face. And I've done that type of stuff. I don't do that as much anymore. Right. I don't do trauma-based stuff unless it's like a broken nose. But I try to stay away from those big reconstructions, because usually those are better done at a big academic center where you have multiple teams of surgeons and multiple, you know, different disciplines in medicine following a patient. But I just focus on, you know, making stuff look beautiful. And if, you know, in some cases, if people have had skin cancer, I'll do a reconstruction. Like if they have a hole in their cheek or their nose that, you know, skin cancer was removed, reconstructing that stuff, or dog bites, stuff like that. But
Gotcha.
I don't do a lot of the big major stuff, but I have, and it's grueling, and I couldn't make a career of it, because those surgeries are 12, 14, 15 hours.
Woo. So when you watch some of these shows like Nip Tuck, and Grey's Anatomy or whatever these medical shows, do you watch them and be like, man, y'all don't know what y'all do. Y'all don't know what y'all talking about?
Yeah, they're pretty lifelike. I mean, obviously they're over dramatized, but you know, I don't watch those anymore. I used to watch them, you know, when I was coming up before I went to school and saw what it was really like. But I don't know. I just can't get into it because it's drama. You know, it's fake. You know what I mean? I can go into the hospital and see the real thing anytime I want to. You know what I mean?
It's like a boxer watching a boxing movie. Like
exactly.
You know?
Yeah. Exactly. Yeah.
Got it. So you know, the whole art. You're into art. You're into making things look nice. How important are things like the golden ratio and symmetry on the faces and stuff like that?
Yeah.
Do you study that kind of stuff?
Yeah, I did study that. That's really important, especially rhinoplasty. We had to study the golden ratio, and I think it's just an important concept because it's like nature's signature on beauty is symmetry, right? So nobody's face is really symmetric. Like if you really stare at somebody, people come to me and they'll say, well, this nostril's higher than the other one, and it'll be like millimeter, you know, small stuff that I can't really see. But I don't ever shoot for symmetry unless there's like a big difference in one side versus the other. But if it's like something that's really minor, I don't really mess with it. But the golden ratio really informs everything that we do in the face, especially because, you know, you got two equal sides, you know, that you're trying to match up. So I don't necessarily bring it into the surgery, but it's just something I'm aware of as a part of my training. And it's a big part of beauty and aesthetics as a whole.
Got it. So 1 millimeter, does 1 millimeter make a huge difference usually, you think?
Depends on the surgery.
Really?
I mean,
Wow.
People can spot it, man. Like, and you know, if people come in and they feel like there's a difference in something and you don't address it, they're going to be unsatisfied. So I try to see it, you know, first, and then I say, well, yeah, I could bring that up a little bit, or I can match that out, you know. But it's creating symmetry is difficult because you can put it in the right place during the surgery, and then it, you know, swelling and healing and how they take care of it and how the wound, you know, goes through the different phases of healing can change the result to where it was like, man, I put it there, but it ain't there anymore. You know what I mean? How did I, you know, people will be really upset about that. So I just start by trying to make it take patients that I can actually fix. Like if I can't see a big difference that I can make or something that makes sense, then I won't do it.
Wow. Okay. Ooh, so what is the healing process like? Or say a client comes to you, they get the surgery done. After they're off of the surgery table and they go home, what's the recovery like? What are those follow-up appointments like with you?
Yeah, so it depends on the surgery. There's always a period of like swelling or bruising, usually like the first couple weeks. There's usually stitches to take out. Any incision that we make, whether it be in the neck or the face or the nose, there's some aftercare. You know, you're going to have to apply. You have to clean the wound. You'll have to put ointment on it to keep it moist to make sure it heals properly. Scars that are visible, you have to keep them out of the sun because you don't want to get exposure to UV light, because that can darken a scar and make the melanocytes make the scar darker. So, and then I always talk to people about nutrition, you know, drinking lots of water, eating, you know, once your body is healing, it requires a lot more nutrition. So you need more calories in your body. So the healing is just as important as the surgery. I would say more in some cases, because you can do the perfect surgery, and if they don't do the proper aftercare, it can ruin your result, you know what I mean, like straight up. And people can get infections, wounds can open up, wounds can, you know, they can over-scar, you can get keloids, stuff like that. So, I mean, I try to baby patients through that first. If they haven't had surgery before, I see them a lot more close to when I did the surgery, so I can make sure they're on the right track, especially with noses, because, you know, you have to do certain things after you do a nose to reduce the swelling, and if they're not doing that, the result can take longer to appear, to finalize. So I do a lot of teaching in the post-op care period just because it's important.
Oh man, that is I see why somebody like you has to do it. Because me, I'd be like, all right, man, I'm tired. I did the surgery. Y'all go about y'all leave me alone, man.
Yeah. Trust me, it's like once you do the surgery, you're just getting started.
Right. Now, do you think that AI and the introduction of AI being pretty much ubiquitous in life now, do you think that that's going to help what you do? Do you think you'll be able to utilize it more to further your efforts?
Yeah, I'm actually working on I did some study in AI, and I think there's a lot of opportunity to help surgeons, not replace surgeons, obviously, but some things that'll make us more efficient. So I'm working on some tools for patients that are, developed by myself, and I have a tech partner. We're trying to build a product, I'll put it that way, but we're building a product for patients, and I think it's just going to make a lot of the guesswork, it's going to take a lot of the guesswork out. Like right now, when patients come in, I give them a handout, a piece of paper with all their instructions on it, but nobody reads the handout, right? So they'll call me and they'll ask me stuff that's on the handout. So I just feel like if we can get AI involved, because people are searching AI anyway, with the right information, and make it something that's easily digestible for patients, that would be a big boost on the educational side. I think also just surgical planning, like, using images, manipulating images to see different outcomes before we actually do it. I know people that I trained under in the past used to actually go in Photoshop and try to manipulate the image for the patient.
Makes sense.
And I think AI is going to be doing a lot of that.
Oh yeah.
People are going to say, I want my nose to look like this, and then the AI is going to basically spit it out. So I think stuff like that will help. And when it comes to the technical expertise, maybe helping us find certain things, like finding a blood vessel or finding a nerve or something like that, where it can map out different things in the body. But I think it's going to make us more efficient.
Got it. So of course, cosmetic surgery is not, I guess it's medical technically, but it's not like disease oriented or anything like that. So how important is it to make sure that the patient is medically able to sustain a surgery like that? Because I'm thinking, like, what if you open up someone's nose and you see they have bone cancer or something like that?
Yeah.
So do they have to go through those screenings and stuff first?
Yeah. So another big part of the consultation is just making sure they're medically fit. Heart disease, lung disease, are they a smoker? That can really impact results. Are they fit enough to do the aftercare? Sometimes, you have to get up and move around, things like that. Are they on medications that could compromise the surgery, like blood thinners? Those are things that we have to sort of suss out before they actually get on the table. I think it's, again, you can do a beautiful surgery and somebody can just be not healthy enough to heal, right? So that's obviously not an optimal situation. So just like being a psychologist, we also have to have a certain understanding of medical conditions that could compromise a cosmetic procedure. So that just comes with being a doctor. A lot of us will send patients for medical clearance before they actually get on the table. So we'll have a cardiologist or maybe their primary just make sure that they're medically fit, so we can protect ourselves from liability there. But it can go bad. You saw what happened with Kanye's mom and some other high-profile examples recently where people, they were just going for a little something, and heart problem crept up, or they had a stroke or a blood clot or something like that. So nobody wants to die for a surgery that is basically elective, meaning it's not medically necessary. And those are the more tragic cases that happen in plastic surgery. And so you just can't be so greedy that you're willing to take somebody who's just not fit. I've seen it happen. I've seen it go bad, and so that's just part of being ethical. You know what I mean, and just being on top of your game.
Yeah, it's not worth it. Risk is not worth it. All right, so we've had a pretty deep discussion, I would say. I mean, I guess it's kind of deep, I want to switch things up a little bit, and I want to kind of get your expertise in your opinion on a few things. I did some research. You know, I did a little. So I didn't do as much school, but I still know how to do research. All right. And I just want you to give me your opinion on some of these surgeries that might have gone a little wrong, and you tell me what you think happened there. Okay.
Okay.
All right. And I'm gonna put the images on the screen in post, so you don't have to hold it up. But all right,
okay.
So
don't get me in trouble, man.
Okay, no. I'm not.
Yeah.
So this first one here.
Okay.
So this lady, she looks like she had some facial work done. You can hold it this way.
Yeah.
But it looks like it may be a little asymmetrical, or maybe just a little too much. Or what do you think happened there?
I think she had some type of facelift, you know, and it looks like, you know, with facelifts, they can. Everything is held up with sutures. So when you put when you elevate someone's facial tissues, the soft tissue, it's being held in place by sutures, which are very, they're supposed to be permanent, but they can lose their strength.
Okay.
And things can start to fall or sag. And so it looks like one side of her face, the left side in particular, didn't hold up the same way the right was, or maybe they didn't pull it and re-anchor it at the same location as they did on the other side, which is, again, that's why faces are like really high stakes, and you know, you really see your mistake in the public eye when you mess somebody's face over. But it looks like her facelift, just, you know, she has a little bit different elevation on one side than the other, and it makes it just look a little bit grotesque, uneven. Yeah. Yeah, you got to be careful. I mean, that's what's happening with Kris Jenner now, is everybody's saying her facelift dropped, and they're scrutinizing her results, and she's saying she's not happy. But like 3 months ago, she was like all the talk of the, you know, facial plastic surgery world. So.
Oh wow.
Yeah.
All right. This
happens.
Yeah, happens. This one's a familiar face. He looks like he has some tape, tape on his nose. Is that holding up the work?
Michael Jackson, man. You know, I actually studied him. I studied what happened with him because one of my mentors, a guy by the name of Monty Harris, shout out to him if he watches this, but he wrote an article about how he actually grew up in Gary, Indiana, and he talked about how, you know, he got into plastic surgery of the face because he wanted to fix. He felt like he was chasing the ghost of Michael Jackson, because even to this day, I got people that come in my office and they'll say, "Look, man, I want you to do my nose. I just don't want to look like Michael Jackson." Like, they can tell you more what they don't want to look like than what they do want to look like, just because his result was so, you know, grotesque. But he actually broke his nose first. I think he was rehearsing for Off the Wall and broke his nose, and so he went to a specialist that was recommended by one of his celebrity friends, and they're the ones who did the first nose job to fix the broken nose, and they did such a bad job that he kept having to come back and try to fix it up. So I don't know if it was, he probably had some body dysmorphic disorder as well, which, but it looks like he had an implant at some point and it started pushing through the skin. And so the tip, probably the skin started to erode, and he had to put the tape over it to try to hold everything together.
Got it.
But yeah, he went through several surgeries, and it was because of the original one going so poorly. But you know, everybody gives Mike this stigma that he just was like, he hated his nose or whatever, but he actually broke it. So I think we got to give Mike some grace. You know?
Yeah. R.I.P. Mike. I'm gonna go see your movie, man.
For sure. That's my favorite artist of all time.
Yes. All right. Another familiar face, Lil' Kim.
Oh man. I was just talking about this with somebody yesterday.
Really?
Yeah, so, you know, Lil' Kim, I mean, I remember her album covers, you know, and just being like, man, she's so beautiful.
Yeah, I think we all remember that.
And, yeah, they just took too much of her cartilage away. You know, I don't know what the conversation was like. She had her nostrils repositioned and brought more toward the middle, and then she had a lot of cartilage shade, just kind of like Michael Jackson. She might have had an implant in there, too. I don't know. She's had a few different versions of her nose, but... You know, she just had a surgeon that just didn't know how to blend and balance her features harmoniously, and that happens a lot. It happened a lot in the 80s and 90s, not so much anymore, because now we have people who are competent and working on different ethnicities. But I think she just had a surgeon that just went way too far.
Way too far.
And once you take it away on the nose, you can't put it back.
Yeah.
So I take a real conservative approach. I'd rather someone have to go back under the knife than for me to be like, you know, I took everything I could take and now I can't put it, you know what I'm saying?
Exactly.
So that's what happened with her. I think they took too much and they just kept trying to, you know, whittle away at it and, you know, try to make it look decent. But I wish she had never touched her face.
Right.
I love Little Kim, man.
Yeah. That's probably, you know, one of those psychological ones that the surgeon might have. They should have probably seen that before they started.
Yeah, and then, you know, people have, like, psychological wounds, you know, like, it only takes you getting teased about a feature when you're a kid for you to obsess about it. You know, Michael Jackson got teased about his nose by his own father. And you get people who come in and their ears stick out or whatever, you know, big lips, big noses, and it just, it can scar people for their entire life. So they come in looking for well-being to their self-image, you know, a fix to their self-image, not necessarily fixing the feature, but just fixing the stigma that they drew from having that feature, and that is very that's an artistic thing as well.
Yeah, because I have vitiligo, same thing Michael Jackson had, and people used to call me Michael Jackson all the time. Yeah, I'm like, okay, I'm the most famous, I'm the richest, whatever. I'm like, okay, yeah, I'm Michael Jackson, exactly. Yeah,
right.
All right, another one. So this one was very controversial, especially earlier this year. So much so that people thought that he was either cloned or that this was someone playing some kind of prank and pretending to be this person. Okay. But it turns out it really was this person, and that person is Jim Carrey. He looks different.
So I would say he definitely had something done with his eyes. I think he might have had an upper blepharoplasty where he had some of the skin removed from the upper eyelid, or maybe he had his brows lifted, maybe both. Because you can see his brows are a lot higher, his eyebrows, and then his eyes look more open. So I definitely think he either had a brow lift and an upper blepharoplasty, or one or the other of those. Maybe a facelift too. But like I said, if it's not done appropriately, you can look like a different person. That's why the face is important, especially the eyes, you know, because you can look like, you know, a different version of yourself. But that's him. I think he just had some work on his eyelids and his.
That's him. Oh, that's your phone. Okay, but that's him though.
Yeah, that's him. Okay. I think that's him. I mean, I don't know. They are cloning people out here supposedly, so I don't know. But that's definitely him. But I could see the difference in his eyes and his brow position that he did something there.
All right, two more. I'm gonna just let you. I don't even know where to begin. It looks like they pinched it too much.
Yeah, I think she had an implant put in, and it's starting to push through the skin. Yeah, this is like, so you're not supposed to have that little cartilage in your nose, and people who have that are going for that super ultra, you know, grotesque looking, you know, out of proportion look. They usually can't breathe that well either. So when you do a surgery this extreme, you're really compromising the breathing, because the cartilage in the nose is what holds it up. When you take a breath in, it provides the structure so everything doesn't collapse. But the tip that you see, that little pointy area, I think that looks like some type of implant. Implants are really popular in Korea. A lot of people over there have like a short, stubby nose, and they want to have like a more of a Caucasian, longer, pointier nose, and they usually end up putting these implants in. But if you follow a lot of these implants forward a few years, you know, 5, 6, 7 years, they start to push through the skin. And that's what I think I'm seeing here, is that she's got something that's getting ready to push out of her skin.
Wow. How do you stop that from happening?
I think that you have to use, a lot of times they use silicone for these implants. Silicone, your body is taught or trained to reject it. It doesn't really absorb into the tissue that well. So you have to use natural materials that your body will integrate into, or else it'll basically, your body will, you know, basically push it out. It will reject it. So you got to use the right materials. I'm not a big fan of silicone implants in the nose. Okay. Yeah.
All right. Last one. Is that your phone?
My phone is on the side.
Okay. And last one. All right. So she looks like, this was giving me Cindy Lou Who. You remember Cindy Lou Who from The Grinch?
Yeah.
Yeah. It looks like maybe she was going for that look, or maybe.
Yeah. So this I gotta talk about this. So this is actually, there's a guy in Turkey. I'm not gonna say his name, don't at me. But this guy's doing, it's called the Whoville nose.
Oh, so
it's like literally called the Whoville nose because it looks like a character from Dr. Seuss.
Right.
And he's basically turning up the cartilages to make them super pointy, and then he's lowering the bridge. Some people want that look. Most people don't, but it's become popular. Like I had mentioned in a previous conversation, people are doing this cat eye surgery where they're pulling the corner of the eye really tight, and they want to look almost like a cartoon character or some type of anime or something. And that's what is happening here. Like, he's brought her nasal bones in really close, and then turned the tip up. And people don't want to be able to look up your nostrils when they're looking straight at you, but there are people who are getting this surgery. I see it all over Instagram. I see his work. He's in another country. People are flying out there for this. And I think you're going to see in a few years nobody's going to be getting their nose done like this anymore.
Yeah.
Because it's just getting out of hand.
Yeah, that looks...
But they're calling it the Whoville nose. There's a whole
exactly
article.
What it looks like.
Yeah, there's a whole article that was written about it. And I was just like... So you can find a trend to do anything on the face. Eventually, people are going to want to try to do it.
But yeah, the name of the show is called Another 24, and the reason why it's called Another 24 is because that's the biggest blessing that we can all get. Is another day to chase their dreams, to hug your family, to start a new path or continue down the same path. But it's we don't agree on much on this planet, but that's the one thing that everybody on Earth can agree on is we want another day of life, right? So there's a young man. He might be in D.C. He might be here in Atlanta. He might be at Morehouse. He's watching everything that you're doing. He wants to be just like Dr. Fletcher. He wants to be the best plastic surgeon in 2046. And he wants to be just like you. But he may be struggling. He may be having a hard go at it right now. But if you could talk to that young man and give him maybe 30 seconds or so of encouragement or wisdom, I want you to look directly at that camera and talk to him and help him continue through his next 24.
Hey, listen, man. Enjoy the ride. Take your lumps. Some of the best lessons are learned by making mistakes. You'll make a lot of mistakes on the road to becoming successful in this. Find good mentors, people who you can learn from their mistakes before you make your own. Find a good circle of friends. Take some downtime to enjoy yourself. Don't take it too seriously. Yeah, you can do anything you put your mind to, for sure. And you got to find your own voice in your head that you can listen to when times get hard. Because some people, when you dream for something big, they're not going to have any advice that they can give you. You're going to have to find the motivation yourself. So work on self-motivation and apply yourself, and you'll be right where you need to be at.
Amen. Amen. All right, last thing before you go, your top 5 rappers. I just got to ask.
Ooh, man, that's tough. I would say, so obviously I got to fill out the easy ones. Like Biggie, Tupac, Nas is way up there, especially like lately. I feel like he's aged the best. I like, who else am I going to throw in there? Andre 3000's on there, man, for sure.
I just went viral talking about him.
Yeah, I know, man. I can't believe he's not the best rapper in Atlanta. I just can't even believe that. I would throw, lastly, I like Mos Def, man. I feel like he's my favorite conscious rapper. I mean, next to Common, but if I got to fill out like a conscious rapper, I didn't have one in the top 4, I would throw Mos Def in there.
Yeah, fire. I like Mos Def. Okay.
Yeah.
My favorite artists of all time. It's a group. It's Bone Thugs and Harmony. I'll just put that out there.
Okay. You don't get a lot of those being number one.
Right. But okay. Yeah. I just had to ask because I'm a huge hip hop fan.
Me too, man. Me too.
Right. So yeah, we gotta talk about that on the next episode.
For sure.
Talk about that.
For sure.
But yeah, Dr. Fletcher, thank you so much for coming by and gracing us with your presence, your wisdom, and your experience and your expertise. This was a great conversation. I learned a lot. And, we're going to be watching everything you're doing. We're going to be supporting.
Appreciate it.
And, when your documentary comes out, you got a place to come and talk about it and promote it.
For sure. Yeah, it's coming soon. So a lot of stuff coming soon. So just keep following.
All right. And that's a wrap.
All right, cool.
Yeah, thank you, man. Appreciate it. That was real good.
Well, yeah, appreciate it, man.
Yeah, for sure.